Are you turning 65, confused about Medicare, and you just don't know what to do? How does Medicare work? Well, you are not alone. In today's video, we're going to break it all down. Well, hello there. My name is Patricia. I am a registered nurse. However, I focus on helping my clients navigate through Medicare each and every day, not on the weekends for the most part. So anyways, let's get right into it. We're going to break it down. By the end of this video, you're going to have a good understanding of Medicare and all of that. So let's get to it. So let's start out with what is Medicare. So Medicare is health insurance offered to individuals in the United States, usually for individuals turning 65, those that have worked in the United States for at least 10 years, 40 quarters, and paid taxes here in the US while they was working. You could also get Medicare if you became disabled and you have enough working credits. So that would be SSDI, which is Social Security Disability. After 24 months of having such disability, then you automatically get Medicare, like I said, after 24 months. Certain disabilities automatically qualifies for Medicare as well. Now, when do you get on Medicare? Like I said, you would get Medicare when you turn 65, okay? But you could automatically get Medicare if you're already drawing Social Security. For an example, if you was disabled, like I said, and you would get an SSDI, you get Medicare after 24 months. If you got Social Security at the age of 62, say you retired early and you went ahead and got your Social Security at the age of 62, when you turn 65, you will automatically be enrolled onto Medicare, okay? Now let's talk about when do you enroll in Medicare for, the standard scenario, turning 65, getting ready to retire from work, and you're deciding, you know what, I'm not going to continue on with work insurance, or I'm going to go ahead and retire from work at the age of 65. You have a 7-month window to enroll in Medicare. Okay, you have the month of your 65th birthday. You have 3 months before you turn 65, and you have 3 months after you turn 65. And we highly encourage our clients to go ahead and enroll in Medicare 3 months before they turn 65 to prevent any delays. So where do you enroll in Medicare? You actually enroll in Medicare via the Social Security office. You could call the office, you could call your local office, you could call the 1-800 number for Social Security. We'll leave the number right here for you. You could also apply online via ssa.gov, and you could also go into the Social Security office, set up your appointment to go ahead and get started with Medicare. Okay, so what are the parts of Medicare? There's several parts of Medicare. You have your Medicare Part A, which is your hospital coverage. You have Medicare Part B, which is your medical coverage. Medical coverage is going to help with going to see your actual doctor. If you only have Medicare Part A, that means you only have hospital coverage. So you need Medicare Part B, like I said, which is medical coverage, is going to cover other things such as diagnostic tests, like I said, going to the doctor, getting your labs done, getting x-rays, imaging, ambulance rides, the emergency room visits. All of that is covered under Medicare Part B. Also, mental health, therapy, physical therapy, occupational therapy, home health, and so much more is covered under Medicare Part B. Now, there's other parts of Medicare, such as Medicare Part C. Medicare Part C are Medicare Advantage plans, and the Medicare Advantage plans actually replaces original Medicare. So when we're talking about original Medicare, we're talking about Part A and B. But if you get on a Medicare Part C plan, which is Medicare Advantage plans, it replaces original Medicare. Why would someone want to replace original Medicare? Well, these Medicare Advantage plans offer things that original Medicare does not offer, such as dental, vision, hearing. Some of them offer transportation, silver sneakers, which is a free membership to the gym. And this is all to just help you stay healthy. So sometimes individuals would get on a Medicare Advantage plan, and then remember, And also, it's very important to take note that Original Medicare only covers 80%, leave you behind 20%. Another reason why individuals would get on a Medicare Advantage plan, because instead of being left behind with that 20%, you pay co-pays with that Medicare Advantage company. They pay a portion, you pay a portion. So it's nice to have co-pays instead of being responsible for 20% of the bill, because you don't know what that 20% could end up being, because it is a percentage versus paying co-pays with a Medicare Advantage plan. Because with a Medicare Advantage plan, at least you know what is your max out of pocket and your out of pocket costs. So that's really nice when it comes to Medicare Advantage plans. Now, if you get on a Medicare Advantage plan, you do have to stay within network, okay? So your doctor will have to be in network if you want to continue to see your primary care doctor or your specialist doctor or your dentist or whoever is your provider is, whether it's mental health or what have you. They have to be in network for you to see them, okay? So with a Medicare Advantage plan, there's two main type of networks. You have your HMO plan and you have your PPO plan as well. With an HMO plan, you need a referral to see your specialist by your primary care doctor. With a PPO, a referral is not required, and you can see providers outside of the network. However, you would pay more for those providers. Now let's talk about Medicare Part D, which is needed. Medicare Part D is for your prescription drug coverage. So how does that work? So you will look at the medications that you're on and you will narrow down what Medicare Part D plan that will work for you, or Part D could be included in a Medicare Advantage plan, which is Medicare Part C. So remember, D for drugs. Medicare Part D is going to be the medications that's prescribed by your doctor. Those drugs will be covered under your Part D plan, okay? So it's very important to do a very thorough search or work with a broker that you trust, like myself. And I would definitely make sure that the drug plan will cover most, if not all, of your medications, okay? So there are different drug plans and offered by different insurance carriers. So you definitely want to make sure that your medications are covered, okay? So that's how Part D works, is for drug coverage. And like I said, you can have Part D included in your Medicare Advantage plan, which is Medicare Part C. Okay, so we're talking about Medicare Part A, B, C, and D. Let's talk about a Medicare Supplement plan. So what is a Medicare Supplement plan? Totally different from a Medicare Advantage plan, and you cannot have both. You cannot have a Medicare Advantage plan and a Medicare Supplement. You have to pick which one works best for you. So a Medicare Supplement plan works directly with Original Medicare. So like I said, Original Medicare covers 80%, leave you behind 20%, and the Medicare Supplement plan job is to pick up the 20% that Original Medicare leaves behind. Now, you will have an annual deductible each year, meaning that you have to pay this deductible before the supplement plan actually kicks in. Right now, the deductible in 2025 is $257 for the year. So once you meet that deductible, meaning if you go to the doctor in January and his bill is $150, you will pay that $150 until you reach that deductible of $257 before the plan will kick in and pay the remaining of the 20% that Medicare leaves behind. Now, what's so great about a supplement? Number one, it follows Original Medicare, so you're not losing Original Medicare, right? That's number one. Number two, you can go to any doctor that takes Original Medicare and is accepting new patients, which is really nice as well. You could travel within the US with a Medicare Supplement plan as well. You don't have to worry about pre-authorization. As long as it is a service that Original Medicare covers, the supplement will follow it and pay that 20%. So it's really nice to have a Medicare Supplement plan. Like I said, you have to decide whether you want a Medicare Supplement or a Medicare Advantage. Now, a Medicare Supplement plan will have an additional premium besides Original Medicare. So you have to pay for a premium for the Medicare Supplement plan as well each and every month. Okay, so there is an additional cost. Since we're talking about cost, let's talk about the cost of Original Medicare. So Medicare Part A usually would not have a cost if you paid Medicare taxes for 10 years or 40 quarters, because you was already paying for Part A when you was working within your taxes. Medicare Part B, however, does have a monthly premium. In 2025, the premium is $185 for the month. Okay, now it also goes by your income as well. So there is something called the IRMAA chart. Based on the IRMAA chart is what you're actually going to pay in your monthly premium for Medicare Part B. Most individuals will pay the standard amount of $185 per month, and we'll leave the IRMAA chart right here so that way you can kind of pause the video and look to see what is your income in the prior 2 years, and that's going to determine what's your actual monthly premium. And it goes back 2 years and it looks at your income tax return. So there's the column where it's going to say single or individuals, and there's a column that's going to be for married couples filing jointly. So that's how you kind of determine how much your monthly premium is going to be for Medicare Part B. And you may have a premium for Medicare Part D as well. So do not forget to look at that column when it comes to Medicare Part D. Most individuals will pay $0 for Medicare Part D premium, but the drug plan itself may have a monthly premium as well. Okay, you have to take all that into account when you're looking at your budget and such when it comes to shopping around for a Medicare supplement or a Medicare Advantage plan. Usually when it comes to a Medicare Advantage plan, the monthly premium would be $0 or very low cost because you do have co-pays. Okay, with a Medicare supplement plan, you pay your deductible, and depending on which plan you get on, the most popular type of Medicare supplement plan is a Plan G. With a Plan G, you do not have any co-pays. However, the next popular plan is a Plan N. With Plan N, there are co-pays, okay? Up to $20 for a doctor visit and up to $50 for a ER visit. So those are the co-pays for Plan N, okay? Like I said, Plan G, no copays. So you have to kind of decide, do you want a Plan G or a Plan N when it comes to a Medicare supplement plan? Let's talk about common mistakes that I want you to avoid, okay? Common mistake number one is thinking that Medicare is free, getting on Medicare and then getting a bill saying you have to pay, this monthly premium for Part B or whatever. That is a common mistake. A lot of individuals think that Medicare is free when you turn 65, and it's not. We talked about the monthly premiums and such. Medicare is not free. Another common mistake is thinking that you do not need to enroll in Medicare. You can skip out on Medicare and there's no penalties. That is not the case. Now, can you delay Medicare if you are working and you have employer's coverage, 20 or more employees? Yes, if you're working, you have employer's coverage, you can delay Medicare. However, any other health insurance coverage, let's go back, you can delay as well if you're on your spouse health insurance, employer's health insurance, okay? Anything other than that, you cannot delay Medicare. I do not recommend that you delay Medicare. Even if you have VA coverage, I do not recommend that you skip out on Medicare. It's very important to get Medicare Part A and Medicare Part B if you don't have any employer's health insurance. If you decide to delay Medicare, when you do get on Medicare, you will be penalized every single month that you decided not to have Medicare if you did not enroll in Medicare within your 7-month window when you first turned 65, unless you're delaying Medicare because of employer's health insurance coverage, 20 or more employees. I have clients that have not enrolled in Medicare past the age of 65, 70, 75 years old, never enrolled in Medicare, don't have any employer's coverage. And let me tell you, it's not fun when you have to pay that penalty. And unfortunately, the penalty is for the remaining of your life. Another common mistake is not enrolling in Medicare Part D prescription drug coverage on time. This is definitely a common mistake that you do not want to make. What happened is once you have Medicare Part B, you have 60 days to enroll in Medicare Part D on time. If you choose not to enroll in Medicare Part D because the most common reason is I'm not taking any medication, so why should I take Medicare Part D, I'm not on any medications, but that is a mistake. You still need to enroll in the Part D plan so that way you don't get penalized later on. So you will be penalized if you don't enroll in Medicare Part D on time as well. And unfortunately, it is a lifetime penalty. So don't do that. Another common mistake that I see clients make is not getting help if they are a low income senior. So if you apply for Medicaid, Medicaid would pay for the Medicare Part B premium. So if you're low income, then I highly recommend that you apply for Medicaid, the Medicare Savings Program, and extra help, okay? Once you apply, it's kind of all in one, okay? I know it's a little confusing, but extra help pays for prescription drug coverage, Medicaid pays for the Part B premium, and the Medicare Savings Program is pretty much all wrapped in one, okay? So how do you apply for the Medicare Savings Program or for Medicaid? You apply via your state. So if you are in Florida, you're going to apply for Florida Medicaid, okay? So you will go to your state website and go ahead and apply for Medicaid if you qualify. It is going to be based on low income and limited resources, meaning you can have one house and one car and less than $9,000 in a bank. And of course, it's going to go by your monthly income as well. So yeah, if you're low income, go ahead and apply for the extra help because, hey, it's not going to hurt anyone. I recommend it to all of my clients that are in fact low income. I hope I made it very clear when it comes to Medicare, you turning 65. I hope I took out a lot of the confusion. If you need help, give our office a call. We'd be more than happy to assist you. We provide ongoing customer service all year round, and we do all of this at zero cost to you. So give our office a call. Like I said, we'd be more than happy to assist you. Thank you so much for watching this video. If you're not subscribed to the channel, subscribe. If you have a friend that may need this information, share this video with a friend. Like I said, thank you so much for watching. If you have any questions, leave them in the comment section below, and I'll be more than happy to answer that question. Thank you so much for watching, and I'll see you on the next video. Bye.